The Royal Marsden opened its doors in 1851 as the world's first hospital dedicated to cancer diagnosis, treatment, research and education. Today, together with its academic partner, the Institute of Cancer Research, it is the largest and most comprehensive cancer centre in Europe, treating over 50,000 NHS and private patients every year. It is a centre of excellence with an international reputation for groundbreaking research and pioneering the very latest in cancer treatments and technologies, as well as specialising in cancer diagnosis and education. We have two hospitals, one in Chelsea, London, and another in Sutton, in Surrey. We also have a chemotherapy medical daycare unit at Kingston Hospital. The Royal Marsden Critical Care Unit, based in Chelsea, opened in September 2010. It has 16 beds on the unit, which makes it one of the largest cancer critical care facilities in the United Kingdom. There are 12 intensive care beds, 4 high dependency beds, and 7 isolation rooms. Each room is identical in its outlay. At the Sutton site, we also run a step-up unit with an additional 2 intensive care beds. Each has a fully interfaced patient information system and high-end entertainment facilities with access to TV and internet. The outcomes from the critical care unit are some of the best in the country for cancer patients, as well as for elective surgery. We admit approximately 1,400 patients per year, of which 70% are surgical post-operative cases. We also specialise in patients who have had bone marrow transplants or are suffering from side effects of chemotherapy. Survival rates for our patients, both from hemato-oncological, bone marrow transplant, major hepatobiliary and upper gastrointestinal surgery, are some of the best in the country. We also have the lowest rates of cross-infection in any unit in the United Kingdom. We have a comprehensive team of doctors, nursing staff and allied health professionals, including dietitians, physiotherapists, pharmacologists and microbiological input. We do daily consultant-led rounds in the morning at 8 a.m. and again in the afternoon at 4 p.m. We advise friends and relatives to avoid visiting loved ones between 8 and 10 a.m. and from 4 to 6 p.m. This is so that we can offer our patients the best care possible by focusing on the ward round during these time periods. However, if needs be, we offer flexible visiting times which we can discuss with our patients and their relatives. Our aim is to provide family-centred care, and in response to overwhelming feedback from patients and their families, we have scheduled critical care unit visiting hours from 11 a.m. to 8 p.m. However, in the event of a ward round or during any procedures, we will have to ask family members to leave.
When you wake up from surgery, it will feel very unfamiliar. There'll be lots of wires attached to you. There'll be tubes coming out of your nose. There'll be wires attached to your fingers. Try not to be alarmed. These are all normal things. The wires are all for monitoring, and you'll hear that the monitoring is working because you'll hear some sounds, usually behind your head. That's just letting us know what your blood pressure is, what your heart rate is, what your temperature is. And in addition to that, you may feel things on you that are new. You may feel a tube in your nose that's going down to your stomach. Try not to be alarmed. That's trying to prevent you from feeling unwell or sick. You may have drains, and you may have a button to press. That's for your pain. And all these things will be explained to you. Critical care is generally quite a busy place. We have 16 beds on this unit, and they're spread out mostly in side rooms, but we do have 2 small bay areas of 4 beds and 2 beds.
We need to monitor patients very closely following surgery. Certainly in the first few days, they require intense monitoring, and therefore the critical care environment offers the best environment to ensure that patients have the best care delivered during this period, and so that we can adjust our treatment hour by hour to ensure that they are tailored to the patient's needs.
Whilst in the critical care unit, you will be attached to monitors continuously that will measure your respiratory and your cardiac function. For those of you that require more support for your breathing, you may also be attached to a breathing machine known as a ventilator. Whilst you're connected to the ventilator, and until you can breathe for yourself, we will give you pain relief and sedation to make your stay on the ventilator as comfortable as possible. It is possible that some of you may need some kidney support whilst you're with us. The dialysis machine allows us to clean your blood and remove any toxins. There'll always be a nurse with you, and as you get better, actually that nurse will sometimes look after 2 patients. But even when that nurse is at someone else's bed space, they'll always be monitoring you and keeping a very close eye on you.
So we work as a team of 7 critical care consultants. All the decisions in terms of care management for patients on critical care is consultant delivered. We closely work together with the surgical consultants as well as the oncology consultants to ensure that the delivery of patient care is tailored to the needs of the patient and is of the highest quality.
We have a number of doctors and nurses who come to the Royal Marsden to have further training both specifically in intensive care and intensive care for cancer patients. We have a comprehensive introductory programme for them to allow them to get used to our ways of working, but also continuing professional development with attendance at various courses and conferences to aid their learning. At present we have doctors and nurses from all over the world, North America, Australasia and throughout Europe, and we hope to continue this in the future as it's an enjoyable programme not only for them but also for us to learn from their experiences of treating patients abroad.
The care that we give at the Royal Marsden, for me, they are really specific, and we have the opportunity to give really good care. I mean, it's varied. You can have CCU patient, critical care patient, or more stable patient with whom you can engage more. You have possibility to support the family if you need time, spend an hour speaking with your patient because he needs reassurance or comfort, whatever. You can do it, and I think that adds values to the nursing. The care that you can provide to the patient is really one-to-one and personalised care.
When it comes to your personal care on the unit, any changes of management or treatment will be discussed with you and you'll feel involved every step of the way. We try and tailor your care to suit your needs. In addition to this, you'll be discussed weekly at our multidisciplinary team meeting. Here is where we get together with all the doctors and nurses and other clinicians and allied healthcare professionals to discuss your progress on the critical care unit. And in addition to that, if you are staying with us for longer than a week, we'll also discuss you weekly at the rehab round, where we really discuss your rehabilitation goals and how we, as a team of doctors, nurses, physiotherapists, dietitians, etc., can really help speed your recovery and speed you home.
At each of our bed spaces we have a computer system called ISIP, and it allows us to take all the information about the patients, including all their observations and any note taking that we need to do. Having ISIP at the bedside makes documentation much easier. It means that we can look back over your length of stay and have all the information that we need to make better bedside consultations.
A typical day on the critical care unit can be quite busy. Not only will you be seen twice a day by the critical care round, but you will also be seen by the physiotherapist, the occupational therapist and the dietitian.
If you had an operation involving your abdomen or chest, your treatment may involve breathing exercises and early mobilization, which will help to prevent the most common chest complications, such as chest infection. If you stay in intensive care for a long period of time because of your illness, you may be kept asleep and possibly attached to a breathing machine. A physiotherapist will come and see you to carry on chest physiotherapy to make sure your lungs are kept clear. During that time, your breathing muscles may become weak. So together with the medical team and the nurses, a physiotherapist will progressively reduce the amount of support from the breathing machine. Physiotherapy may also involve arm and leg exercises while you are in bed to help you regain strength and to prevent your joints from becoming stiff. It is very important we intervene early to minimize the consequences of prolonged bed rest and the lack of activity, which may be loss of muscle tone, weakness, stiffness and fatigue. We may also refer you to occupational therapy so you can start carrying out daily tasks such as washing, dressing and feeding yourself. Together with the multidisciplinary team, we will tailor a rehabilitation program to your needs, setting up goals with you and your family every week to help you recover from your stay on the intensive care unit.
When you're in intensive care, we actually have a dietitian who specialises in critical care, and she visits patients on a daily basis and makes sure that the way they're nourished is appropriate and meets their needs. During the period of time in intensive care, we may be using different methods of nutritional support, but the dietitian keeps a very close eye on what's required and how that's delivered in a safe way.
I work as an integral part of the CCU team to help ensure that the doctors and the nurses have all the information that they need about the medicines that we use or the medicines that the patients are using before they come into CCU.
The critical care can be a noisy place, and often sleeping at night can be difficult. If you're struggling to get to sleep, just speak to your nurse and they can provide you with an eye mask or earplugs or night sedation if you really need it. By every bed space in the critical care unit is an About Me board. And there'll be some details on that board that you can give us, and maybe your family members can give us, about your likes and dislikes. This may be the kind of TV you like to watch, the music you like to listen, your hobbies, and the things you really don't like. This helps us, especially in the times when you're asleep, to tailor our care to your needs.
We have a wonderful outreach team, a group of specialised nurses who are all critical care trained, and they will look after you on the ward and provide the link between critical care and the ward.
Whilst you're in the critical care unit, it's possible that you may become a little bit confused, a little bit agitated. You may behave in a manner that is very unusual for your personality. The cause of this is usually because either you've received sedative medications, or because you've been unwell, or possibly because you've been sleep deprived in a very abnormal environment for you. Whatever the cause, it can be very distressing both for you and for your relatives. However, the most important thing to remember is that despite the fact that it's very abnormal and distressing, you will come out the other side. The length of time that it will last for is very variable. It can be anything from hours to several days, and it can also be intermittent in nature. You may find that during the day you're absolutely fine, but at night, as I say, you become confused. The most important thing to remember is that this confusion and agitation will pass. Your personality will return to normal, and by the time you've left the critical care unit, you'll be feeling just yourself again.
So when you're ready to go home, when the doctors have made the decision that they're happy for you to be discharged home, either myself or the doctors on the ward will write up your medications. We'll then liaise with your practice nurses and your GP for any follow-up appointments, and I will also organise an appointment in the outpatients clinic for you to come back. Should you have any concerns when you get home and you want to speak to somebody from the Royal Marsden, you'll have either my number or one of the clinical nurse specialists' number, and will be your first port of access back into the Marsden should you have any concerns.
So when patients are discharged from the critical care unit, it can be quite hard to adjust to life back at home. And so one of the things that we do, and there's national guidance that we should do this, is that we see patients around about 3 months after they've been in the critical care unit. And we might see them face-to-face in clinic, or we might telephone them and to see whether we need to bring them into the clinic. And at this clinic appointment, we would review patients and see whether you needed particular help in anything to do with your physical recovery, or even your well-being and how you're feeling in yourself and how you're feeling about your stay in the critical care. And then we would try and see if we can work out how we can best support you and who we can signpost you onto, and we may well refer you on if that were what was needed.
The critical care is very much shaped by our values. They are unique to us and make us who we are. And our values are being open, providing compassionate care, providing personalised care, and providing support. And not only do these values shape the kind of clinical care we provide our patients and their families, but it's also very much the blueprint that we use for supporting and caring for our staff.
So the vision for the unit is to be leaders in cancer critical care and to provide excellence in care for critically ill cancer patients.
As soon as I got an appointment with the Royal Marsden, made contact with the clinical nurse specialist, and was treated as one of the families, is how I felt. They wanted to know how I was feeling, how I was doing, anything about symptoms, anything else going on. So I was made very welcome, and they really showed a huge amount of care for how I was feeling. I was on the critical care unit for 7 days, but that time passed fairly quickly because there's lots of activity during the day. I think I just want to let people know that everybody at the Royal Marsden is incredibly supportive, and that Royal Marsden really know what they're talking about, and if they say this is the right treatment for you, believe it, because they know what they're doing.
All the staff I found really wonderful, obviously very dedicated. I thought very well trained indeed. If you had to have what I had, you know you're in hands of total experts who are going to look after you absolutely wonderfully, and who have dealt with cases such as yours several times before, so they have all the expertise they need. I thought the whole thing was wonderfully managed, and on a general note, you couldn't do better than the Royal Marsden Hospital.